So I qualified in 1992, so that will be 23 years, which seems a huge amount of time. And then from there I went to the London, because I trained in London, so I went to the Royal London in Whitechapel and was there for about 3 years doing quite a few disciplines, which was excellent experience. And then from there I went into some private hospital medicine, got to the London Clinic, got to various other hospitals, the Chest Hospital, and then went to Charing Cross. And then after that, I came out here, and I've been here for 8 years. Well, when I first arrived here, I was working in one of the practices over in Rudgwick, and that was general musculoskeletal, which is really nice because it had a much more of a local feel. And then since I've been transferred back here, I've done a mixture of physio and Pilates since I trained as a Pilates instructor a couple of years ago. And that's been really good because it's moved over the gap from patient having treatment to patient actually going through rehab, and then it becomes more of a positive experience because they're learning how to look after themselves, and I think that's what we've got to teach people these days. Yeah. I think a combination of things. I think my parents, were quite instrumental in it, and I think they probably saw that I was more practically minded than bookwork. And I wanted to do a vocation, so I wanted to actually have some qualification, and at the time I then thought, I'll use it as a ticket to travel around the world, but to date, 23 years later, I still haven't used it abroad.